Time now for our Ask the Doctor segment. You can call our phone lines at numbers 334-420-9732 to get your medical questions asked by Dr. Brian Sellers. Dr. Sellers is joining us now here on Alabama Live. And Dr. Sellers, remind people what you do. What kind of doctor are you?
Sure. I'm a vascular surgeon. So we work on disorders of the arteries and veins throughout the body. I don't work on the heart, but we do work on the arteries in the neck, the abdomen, and the extremities. We also do dialysis access and varicose veins.
And obviously October is Breast Cancer Awareness Month. Talk a little bit about what you all do for breast cancer patients at your office.
Sure. So our interaction with cancer patients normally is in the role of providing access for their chemotherapy medications. So for chemotherapy, that is typically delivered IV, and these patients have to have IV started every time they go to the cancer center. So we'll typically insert a port underneath the skin that can be accessed directly. It allows the cancer center to draw labs and to give them their infusions with minimal difficulty, and it doesn't burn up the veins in their arm. But breast cancer is obviously a very big health concern here in the U.S. Worldwide, it's actually the leading cancer diagnosis for women and is the leading cause of cancer deaths for women across the world.
How does that port help them as far as quality of life when they're going back and forth between so many doctors?
It usually is a very convenient thing for them. So instead of having to get multiple IV sticks, get stuck for labs every time they need to get their infusions and get their IVs done, it usually is very convenient for them. It's just a simple port underneath the skin. It's easy to see, or it's easy to feel. And usually as the chemotherapy progresses, the veins tend to get scarred down and burned out. And starting peripheral IVs can just be a big hassle and a very painful and uncomfortable process for them. So having that port, usually most of the time, is more convenient for them. It's just easier to get their treatments done.
Are these patients usually referred to you, or are they someone you've already been working with?
They're usually referred to us. The primary diagnosis of breast cancer is normally made through screening and primary care physicians. When a patient is staged and is determined that they need chemotherapy, that's typically when they're sent to us for the port.
Dr. Sellers, you mentioned obviously you're a vascular surgeon. Talk a little bit about some of your other patients. Who do you typically see in your office daily?
So one of our big focuses is peripheral arterial disease, or blockages in the arteries in the legs. That is something that is it's almost endemic here in the South. I grew up in Alabama. We have a very specific diet, and we are not the best at living healthy lifestyles and getting the exercise we need, and that all kind of predisposes us to plaque buildup in the arteries. A lot of patients come in because they just have nondescript leg pain. Their legs bother them when they walk. They have a hard time doing what they need to do, and it's usually attributed to old age or arthritis or whatever people want to say it may be. When they come in, they often have something more going on. And the reason it's important to diagnose is because if we find it early, we can usually prevent some very bad outcomes, which could be things like amputation, limb loss, those kind of things.
And we have a caller on the line, Ann from Selma. Ann, what's your question?
Yes. I have cellulitis. Do you treat that?
We do. So cellulitis is usually treated with oral antibiotics and IV antibiotics. That's also something that can usually be treated also by your primary care physician. But certainly when people come into the office with it, we address it appropriately.
Okay. Is it serious?
It depends on how bad it is. Certainly a bad cellulitis can require hospital admission and IV antibiotics.
Okay. Thank you.
Yes, ma'am.
All right, Ann, thank you so much for calling. And after the break, we will continue our Ask the Doctor segment. If you have a medical question that you want answered, give us a call. That number is 334-420-9732. Plus,